Welcome back to our Alzheimer's and Dementia training series. In this module, we're focusing on one of the most crucial responsibilities we have as caregivers: preventing abuse, neglect, and exploitation of those living with dementia. Because these individuals trust us with their lives, and they deserve to be safe, respected, and protected. Note that patients with dementia often struggle to report abuse or explain what happened. They have memory gaps or communication barriers, which makes them easy targets for neglect or exploitation. Abuse can be physical, emotional, sexual, financial, or even verbal. Neglect is failing to meet a patient's basic needs, like hygiene, nutrition, or safety. Exploitation means taking advantage of a patient's vulnerability for personal gain. Even small oversights can lead to serious harm if we're not careful, attentive, and committed to protection. Common risk factors for abuse and neglect include understaffed facilities, caregiver stress and burnout, poor training or lack of supervision, isolation of the patient, and unrecognized patient rights. Recognizing these risks is the first step to stopping them. What are some prevention strategies? First, stay patient and present. Dementia behaviors like agitation, wandering, or repetitive questions can be challenging. Never respond with frustration, force, or rough handling. Step away and seek help if needed. Second, monitor for red flags: unexplained injuries, bruises, or fractures, sudden emotional withdrawal, fearfulness or flinching, poor hygiene, dehydration, weight loss, missing money or possessions. Then, follow mandatory reporting laws. If you suspect abuse, neglect, or exploitation, report it immediately according to your facility's policy. You are a mandatory reporter. You are legally and ethically required to speak up. Next, treat every patient with dignity and respect. Use a kind voice, gentle touch, and patient-centered communication. Ask for consent. Involve patients in decisions whenever possible. Honor their personal space, privacy, and preferences. Preventing abuse isn't just a task, it's a mindset. Every small act of respect, kindness, and attention adds up to a culture of safety and trust. In dementia care, we are not just caregivers. We are guardians of safety, dignity, and trust. By staying vigilant, compassionate, and proactive, we can ensure that every person living with dementia receives the care and protection they deserve. Have a tip for preventing abuse or neglect in dementia care? Share it below to inspire and educate others. Like this video? Give it a thumbs up and subscribe to continue through our hand-in-hand dementia training series. And remember, protect their dignity, preserve their safety, honor their trust.